Happy New Year, everybody, and welcome to 2018. Right in the middle of winter at the moment, we're all facing the significant challenges that winter brings to the NHS, and thank you for all that you are doing to keep our patients safe and provide high quality care during what is an incredibly busy time for us all. Some great news: we've had some additional resources to cope with some winter pressures in mental health, which is great. They'll be invested around our crisis response and our liaison services into the acute hospitals. We've also got to focus on our keeping people out of hospital, keeping people well, but also when they are in hospital, getting them out as quick as possible. And it's really important that we focus on helping people move on as quickly as possible. It's also important you keep well at this time of year, and I'd still encourage you, those that haven't had it already, to have their flu jab, to keep well. We know flu is about this winter. We don't know quite the level of it, but it's really important that you keep you, your family and your patients really well and don't spread the flu bug around. So 2018 is going to be a big year for the NHS. It's the NHS's 70th birthday, and we've all got to respond because the pressures on the NHS grow and grow. To celebrate the NHS's 70th birthday, we need to make sure our services are as good as possible, good as they can be with the resources that we have. We know there are transformation programs going on in our community health services, in our adult mental health services and in our CAM services, and we've got to really seal in the benefits of those transformations during 2018 to make those services more sustainable. And that's going to be underpinned by a new clinical strategy, which I hope you've seen on emails, trying to define the clinical models that we're using to make sure that we're providing the right care in the right place at the right time, underpinned by a relentless commitment to improving the quality of those services. We want to make sure everybody in the NHS and everybody in LPT has the skills with which to improve what they do. The other thing that's happened since I last spoke to you is that the draft National Workforce Strategy has been released. You, our workforce, the people that work for LPT and the NHS, are its most important asset. We can't do any of this without you and your commitment. And the workforce strategy, the draft workforce strategy, is outlining how we're going to move forward over the next 5 to 10 years, how many people we need, what sort of skills they're going to need, how we're going to recruit people, how we're going to retain people, how we're going to train people, and how we're going to inspire them. It's worth a read. It's 145 pages long. It's out for consultation, and the final version is going to be released on or about the NHS's 70th birthday in July. I think it's worth contributing to because it is you are our biggest asset, and it is really important that that strategy is right and that we can implement it locally. And finally, I just want to encourage you all to nominate your colleagues, your team, your friends for the Celebrating Excellence Awards. They're a great evening. It'd be great to have as many nominations as possible for those awards. The closing date is at the end of January, so if you've had some further ideas about people who you think are deserving of a nomination, then please put pen to paper and then we can look at those and we can have a really great evening together later on in the year. Thank you very much.